Dear friends, my name is Dr. Igor. I'm a clinical oncologist practicing since 2010. Today we're talking about osteoarthritis and rheumatoid arthritis and natural remedies available for today. Let's get started. Dear friends, osteoarthritis is the most common problem with joints that causes pain, stiffness, loss of function of joints, and their main treatment is non-steroidal anti-inflammatory drugs that may cause gastric stomach problems, that may cause kidney problems or thrombosis, and the other disease is rheumatoid arthritis. It's an autoimmune condition when immune system is hitting own joints, very severe inflammation, lots of deformities of the joints. Morning stiffness is very severe, loss of function also, and most of the drugs, they have a lot of side effects also. For example, some of the drugs, they are aimed at decreasing the inflammation and autoimmunity, like they're blocking tumor necrosis factor alpha, like etanercept, infliximab, rituximab, interleukin-1 antagonist like anakinra. Also, methotrexate is folate inhibitor, and these drugs have really severe side effects. For example, they can cause severe infections. That's why we always want to find something that will be some alternative that will be more safe and well tolerated and won't have so severe toxicities. That's why we're interested in natural compounds. To generalize, natural compounds, most of them can cause decreasing inflammation in inflammatory markers. They can decrease the degradation of the cartilages because they will block, for example, collagenases. They will block metalloproteinases. These are enzymes that will destroy the collagen and destroy the joints. And if they will block them, and they will be antioxidants because there is inflammation in the joints. There will always be free radicals there, so they will protect the joints. And the first herb is arnika montana. First clinical trial of arnika montana is almost 80 patients, and they used this gel for their osteoarthritis of the knee joint. And it really decreased the pain, stiffness, increased the functionality of the joints after 6 weeks of use. But the first improvements were seen after only 1 week of use. There was other study, it included more than 200 of patients. It's double-blind, randomized, placebo-controlled. There was a group of placebo, there was a group of arnika montana. There was also a group of ibuprofen. This is the standard drug, non-steroidal anti-inflammatory drug. And arnika montana was not inferior to ibuprofen, and they were both better than placebo. And there is also other study you can see here, and a new Cochrane review of literature showing that the topical herbal remedies may be really effective for treatment of joints. One more remedy is boswellia serrata. They used capsules, and the new drug, eflapine, containing boswellia serrata, the older drug is 5-loxine, and also they used a placebo group, 20, 20 and 20 patients in each group. The study length was 90 days, and they found that it really helped better. Both of the drugs, both of their preparations were more effective than placebo in treating their joint problems, because they decreased pain, they decreased inflammation, they improved the functionality of the joints. And one more study, 30-day double-blind, placebo-controlled, randomized trial. Also significant improvement of pain and functionality starting already after 5 days of intake of these capsules. Devil's claw or harpagophytum, they used equus extract. It was 2,400 milligrams and they're corresponding to 50 milligrams of harpagoside a day. Significant improvement of pain and stiffness was observed, and it was a 3-month study, and patients with hip and knee osteoarthritis. Unfortunately, there was no comparison group. But there are other 3 studies that also supported these findings. In general, the dosages of harpagophytum, the main active substance of this devil's claw, was 50 to 60 milligrams per day and from 8 to 16 weeks. Equisetum arvensae is another remedy. It may be very interesting for patients with rheumatoid arthritis because it really decreased their autoimmune and inflammatory indicators in such patients. And the study was also 60 patients and 2 groups, placebo and horse-tail mixtures group. Also, I want you to remember about curcumin that can effectively decrease pain and inflammation in such patients. For example, one study included 16 patients with rheumatoid arthritis, and it was not inferior to the standard anti-inflammatory drug. And the other study were almost arthritis patients. Cumin could decrease the inflammation and pain in these patients. Also, don't forget about nigella sativa. That is a good immune modulatory remedy. There are 3 studies of black cumin on patients with rheumatoid arthritis. They all showed the decrease in activity of this disease. By the way, the dosages were from 1 to 2 grams per day in capsules. They used their grinded seeds of black cumin, and this also can be a good adjunctive treatment for this disease. Also, there is a trend now about mushroom amanita muscaria, and according to many people, I didn't see any studies, but according to many people, their local usage of this remedy may really improve the pain in joints. Dear friends, if I forgot to tell something in this topic, if I find something new, then I will add, maybe make a new video or add something into the description and pinned comments. So please see them below. And I hope it was useful and interesting for you. Don't forget that this lecture doesn't substitute the consultation of the doctor. I wish you good health. God bless you. Bye bye.